a former CIO for a large health system, and we had similar populations to the population that you're talking about. So I'm going to change this up as, okay, you had me at hello, I'm interested, but now I need to understand it further. So are we talking about client-facing technology? Are we putting something on a phone? Are we talking about technology that we're putting in front of care navigators that's connecting the housing, transportation, education needs and those kinds of things? What are we talking about?
Yeah, let me explain the technology a little bit. On the patient-facing side, there's no apps to download, there's no portals, there's no websites or logins to remember. It's it's primarily a text messaging based program and phone. And we have some web surveys as well, but it's primarily a text-based program. And we do automated push campaigns, bidirectional AI communications, and then two-way communications as well for navigators and for care teams. So on the patient-facing side, and this has been hugely important to the hard-to-engage communities, that it's leveraging the tools that they have in their pocket today. It works for at-risk and vulnerable populations. It also works really well for commercial insured patients, and that's been a key part of the program to getting really high engagement rates so that we can connect with patients early, we can get more frequent data points, we can build connectivity, we can understand who they are. And then we also have the navigators. And so some of our partners will work with outsourced navigators from Docent. Some of our partners just license the technology to scale their teams, their care managers, social workers, community health workers. But the technology platform then is really designed to integrate data sources from the EMR, from the practice management system, HCAHPS billing to get a holistic profile of who that patient is as a person, and then workflow tools that we queue off of that'll then surface activities up into a care management platform for the navigators to use, or then triggers messages directly out to the patient. And so there's a really coordinated program that's built to sort of longitudinally guide a patient through that journey. And we're surfacing up the right information at the right time to keep them engaged and on track. And as we learn more about them, as we capture social determinants of health, as we capture personal preferences, we can then, we have a mapping of what the resources are, and that could be community resources or hospital resources or clinical resources or digital apps to download. We can make the connections between the patient attributes and the attributes of those programs to know what are the next best steps or what are the next best resources to get those individuals connected to.